Hello guys, I'm back with the continuation of the CCF nursing care plan. Okay, so I already wrote the problems. I just want to run through on how to write the rest of the problems. So the 7 problems that we identified were altered breathing pattern, reduced oxygen tissue perfusion, altered nutritional status, less than body requirements, self-care deficit, anxiety, risk of pressure cell formation, risk of acquiring nosocomial infections. Okay, so the next problem was reduced oxygen tissue perfusion, or you can write it as poor oxygen perfusion to the tissues. Okay, so like I said, this you just copy paste it in the nursing diagnosis. Okay, so reduced oxygen tissue perfusion related to pulmonary edema evidenced by cyanosis. So what you're going to see in relation to poor oxygen perfusion is cyanosis. Okay, not dyspnea. No, those two are different problems. Altered breathing pattern and reduced oxygen perfusion are two different problems because the evidence is different. With something to do with airway, maybe the airway is not patent, you see difficulties in breathing, that is dyspnea. But with oxygen, this one happens at cellular level, so you are going to see cyanosis. Okay, then our aim always start with the word patient. So patient's reduced oxygen tissue perfusion will be improved within 30 minutes of my nursing intervention. So remember, this one is a cardinal sign and symptom, or it's a cardinal problem, and you don't have to wait throughout hospital stay for you to work on it. So 30 minutes is the best. Okay, then our interventions: position the patient, remove any tight clothing, administer oxygen, check oxygen tissue perfusion using a pulse oximeter, and others. Okay, then remember to put your interventions. Then if you can see the arrows, so the aim, evaluation, what you wrote on your aim would be, you just borrow the words. So patient's reduced oxygen tissue perfusion has been improved within 30 minutes of my nursing intervention, evidenced by no cyanosis. Okay, or no pallor. That is the same. Then our next problem is altered nutritional status, less than body requirement. So I said this one you always have to state whether it is less than or more than body requirement. Okay, then our diagnosis will be altered nutritional status, less than body requirement related to anorexia. Okay, now the anorexia here is coming in because I'll try and make another video in relation to the differences between left-sided and right-sided heart failure. Okay, so the anorexia here is coming in because of if the left side of the heart is the one that has failed, for example, you're going to have a sign and symptom of anorexia because of the congestion of fluid which is accumulating in the abdominal cavity. Okay, so anorexia evidenced by patient losing weight of about 2 kg from 56 kg. Then our M, always start with the word patient. Patient's altered nutritional status, less than body requirement, will be improved throughout hospital stay. Remember, our aim needs to be SMART. Okay, so throughout hospital stay, this is better because you'll be able to see if the patient is gaining weight or not. Okay, then our interventions: I will help the patient to do oral care to improve appetite. I'll give the patients more frequent meals. I will provide foods rich in carbohydrates for energy. I will restrict sodium intake to prevent fluid retention. Then you can also add, maybe I will weigh the patient. Okay, you want to see if the food you are giving is helping at all or not, if the patient is still losing weight, and so on. Then our evaluation: patient's altered nutritional status, less than body requirement, has been improved throughout hospital stay, evidenced by patient gaining weight of 2 kg. Okay, now here, remember, it's just the opposite. It's the opposite of what you wrote on your this was our nursing diagnosis. So here the patient was losing weight Here the evidence would be the patient is gaining weight. Okay. Then our next problem would be risk of acquiring risk of acquiring pressure sores or risk of pressure sore formation. Okay. Then our diagnosis is risk of pressure sore formation related to fluid retention. Okay. Now remember, this is a risk problem. It doesn't need to have an evidence on your diagnosis because the risk problem has not yet happened. Okay, so there's no evidence. But at the evaluation point, you need to put an evidence because you have come at the end of your problem interventions. You have done what you can. The patient doesn't have pressure sores, so what is the evidence? Okay, then our aim, patient's risk of pressure sore formation will be prevented throughout hospital stay. Okay, I hope we understand why. It is because of fluid retention. Remember, this is congestive cardiac failure. Okay, and if the fluid is retained in the body, the skin might be impaired. Yeah. Okay, then our interventions, I will do pressure passive exercises in the patient to promote blood circulation as well as fluid circulation. Then I will perform pressure area care. I will put earrings. I will make sure the linen on the bed it doesn't have creases. Okay, so these creases are like wrinkles. Okay, so these can also cause problems with the skin. Okay, can cause skin integrity to be impaired. So you need to make sure that the bed linen doesn't have any creases or wrinkles. Then another point here that you can add is you should make sure that the linen is tucked in with metered corners to prevent creases. Okay, then our evaluation, patient's risk of pressure sore formation has been prevented throughout hospital stay, evidenced by no pressure sores. Okay, or you can say intact skin, something like that. Okay, then other problem is risk of acquiring nosocomial infections. Please, you should make sure that this is complete. Don't just say risk of infection. Is it risk of acquiring or risk of spread? You find that there are certain problems like cholera, TB, those have got a risk of spread of infection. So you need to be specific with your problem. Okay, so risk of acquiring nosocomial infection. Then our diagnosis will be risk of acquiring nosocomial infections related to prolonged hospital stay. Okay, then sometimes it could be due to lowered immunity, like for example those with HIV, or if it is a child and all that. Okay, then our aim, patients' risk of acquiring nosocomial infections will be prevented throughout hospital stay. Then our interventions, you should make sure the patient is nursed in a well dusted and clean environment to prevent infections. You make sure all equipment are sterilized as you are using the patient that are used on the patient to prevent nosocomial infections acquisition. Then I will use aseptic techniques so that you don't allow the patient to acquire nosocomial infections. Then give prophylactic drugs if it is in relation to the hospital policy. This will help also prevent the patient from acquiring nosocomial infections. Then our evaluation, remember, it should have an evidence. Okay, so patient risk of acquiring nosocomial infection has been prevented throughout hospital stay, evidenced by patient having no signs of infection. Okay. Alright, so our other problem is self-care deficit. So self-care deficit diagnosis related to patients having general body malaise, evidenced by patient unable to perform activities of daily living. Okay, then our aim, patient self-care will be improved throughout hospital stay. Then our interventions, I will help the patient to do oral care to improve hygiene. I will help the patient to do assisted bath to promote hygiene and maintain self-care. I will help the patient to change soiled linen and any clothes that are soiled to promote hygiene and improve self-care. I will help the patient with nail and hair care to promote hygiene and promote self-care. Okay, now with this one, if the patient was in a coma, you are not going to help the patient. Okay, here you're going to do on the patient to promote hygiene or to improve hygiene. Okay, here, because the patient is partially bedridden, that's why you are helping. If the patient is completely bedridden and is in coma, you're going to do. Okay, I hope that is clear. Okay, then evaluation. Patient self-care has been improved throughout hospitalization, evidenced by patient able to do daily activities. Now, if the patient was in coma, the evidence here is not patient able to do daily activities. It will be patient looking kept. Okay, then the evidence here, if the patient was in coma, will be patient looking and kept. But then also the related to, it won't be due to body malaise if the patient is in coma. You just say self-care deficit related to patient being in coma, evidenced by patient looking and kept. Okay, I hope that is clear on the differences in relation to someone who is in coma and someone who is not in coma. Okay, then anxiety. Okay, anxiety will be related to patient not knowing about the condition. They need to be evidenced by patient being restless. Okay, now if you want to write anxiety and the patient is in coma, the anxiety mostly will not be seen in the patient. It is true that the hearing is the last sense to go, but it would be more comfortable if the anxiety will be related to maybe the relatives. Okay, so meaning here it will be evidenced by the relatives being restless or relatives asking too many questions. Okay, because if a patient is in coma, how are they going to ask questions? That's not possible. Okay, neither are they going to show that they are restless. So if you're going to have anxiety in someone who is in coma, okay, it will be better you write it in relation to the relatives. Okay, then so patient's anxiety will be allayed throughout hospitalization. Okay, then if it was the relatives, so it will be patient's relative anxiety, patient's relatives anxiety, or you say anxiety of the relatives will be allayed throughout hospital stay. Okay, then interventions that you're going to do, you explain. So I will explain the disease process, okay, to allay anxiety. Do make sure that you explain every procedure, okay, every procedure done on the patient to allay anxiety and gain cooperation. Then explain all drugs and whatever is being given to the patient to allay anxieties and to gain cooperation. Then you can also involve the relatives, okay, in the care of the patient, or any other bedside in the care of the patient to allay their anxiety. Okay, then here our evaluation. Remember, we are borrowing the words from the aim. Okay, so what we wrote here exactly, and we evidenced by the opposite. So it will be patients patient's anxiety or anxiety of the relatives, okay, has been allayed throughout hospitalization. Evidenced by, so here we said restlessness, so here you can say evidenced by patient being calm. If the evidence here was in relation to asking a lot of questions, so our evidence would be evidenced by patient being or patient asking less questions. Okay, and that's it. I hope it has been helpful, and remember, you can use this nursing care plan in any condition. Okay, thank you for listening.